Patient Registry Advances and Goals, Dr. Ken Culver, Colin Barton, and virtually Dr. Morhaf. We have Dr. Morhaf queued up. Morhaf's queued up. All right, here we go. All right, without further ado, I'll get it out of the way.
Hi, good morning, everyone. Can you see me okay? I imagine yes, so I should go ahead. I also have with me two of my, yes, great, thank you so much. I have two of my other colleagues as well, so maybe you could pin us all three in there. My colleagues, fellow researchers, Nicholas too, and Shruti Sravanam. We're here with you with the ALK-positive registry team. Thank you very much. Please move to the next slide. Yes, this is my goal. The goal for the presentation today, and this will share with you some of the work that's actually funded by the ALK-positive Foundation. This work is yours. You helped support its launch. This work started with Colin's efforts and an initiative. Probably Colin can share later some of the history, where he wanted to collect information from the community about the community, so when to present it with to other pharmaceuticals or to other groups to let them know about who we are in the ALK-positive group, that can be useful and standardized. I'll share a little bit more about myself. My name is Morhaf Achkar. I'm an associate professor here at the University of Washington, but I'm also a stage 4 lung cancer survivor. I was diagnosed in 2016, and I've been doing fairly well since then. Actually, I'm currently at the University of Washington, but I will be moving to Detroit. I will be at Kermanos Cancer Center, accepted the position of Associate Cancer Director for Education, helping with pipeline development and faculty development. So, but here we'll be sharing with you about the registry. And we wanted to get to share with you some information about why it is important to bring people together. Why is it important to survey people, gather those information, have them readily available. We'll also share some of the initial reports, some of the that we did, some of the results, preliminary results, and we're looking specifically at the diagnosis, experiences of people with ALK-positive, and then tell you about our plan with expanding this work in next steps. Next slide. So a survey like this, a registry like this, serves multiple purposes. Survey is a tool that you send to people so they can complete and gather information from them. It can help us understand past experiences of diagnosis, current experiences of treatment, and how people are doing in their survivorships. It can help us identify factors that help us, to let us predict who does better, and some of the elements that made some experiences not as good as others. So that's very important in predicting and potentially addressing some of those if they're modifiable. This is a real life analysis. So as you know, with clinical trials, and they're very, very important because they give you information and designed to see what works in this group versus the other group. But then you want to know with real life data, with real people, how the drug is working and how the people are faring. That's why when we do surveys like this or registries like that, you can track people over time and seeing how they're doing. Finally, and most importantly, this is where, as building on what Ken was sharing earlier, this is where you can go to other groups and tell them this is an organized group and we have access to everyone in this community, and we can tell you who has what, who's on what treatment, who's on what stage, who's on what treatment did not work, what treatment are working currently, and that can help recruit people for further research study. Next slide. So this is a global registry. Our goal is to get the universe of people with ALK positive from all across the globe. Our goal is to do this longitudinally, and this is Morhaf Achkar who's speaking. And the goal is to do this longitudinally and do this survey twice a year. So by that, every 6 months, so you can gather information not just about the demographics, who this group are, what happened in their past, but also how they're doing as time progresses. And this is, again, as I said, longitudinal. So as we do this, we identify factors that help or help us predict who's doing better, who's not doing as well as we like. And then, because this is international, help people across the globe to come together, especially for further research and further investigations in this area. This is also led by a group from the ALK positive, myself, Ken is there, Colin, and a stakeholder group from patients, from caregivers as well. The University of Washington is overseeing this research. Next slide. So this will, the recruitment of people for this registry, we're trying to get, as I said, everyone from everywhere. And we're doing this by talking to people like you, by talking to in the support group, but also now sharing with the oncologist and hoping that we get from them, we're giving them flyers to recruit for us, to help us recruit every person with ALK positive. Again, this is for adults, so any person over the age of 18 with ALK positive lung cancer diagnosis is eligible. If someone has deceased, a caregiver can still complete their survey. Actually, this becomes very, very important for us, especially because we're trying to, again, understand who's doing better and why and what factors. So when people develop the worst outcomes, we want to also know about them and about their experiences. Next slide. We're using, this is a survey, so you're probably familiar with some of the platforms. The link is shared in there by Mark, thank you very much. With RedCap is where you will be collecting the survey. It's HIPAA compliant, and your information will be, everything's kept confidential. People will not access your identifier. It's not important for the study. Their staff team, Nicholas, I will talk to you shortly, is available to help you if there are some difficulties and challenges in recruiting, in completing the forms, but your identifications are not important. And everything, of course, is in a safe and secured platform. Then when we share, we get the data, we'll have it available not just for the scientific community, but also for any entity, any stakeholder that is involved in the advocacy for the ALK positive, or in research, or in pharmaceutical, or developing newer treatment as well. Next slide. So the survey, this is a very comprehensive instrument. It is designed to be comprehensive, designed to include everything. That's why it actually takes time to complete. And we want you to, if you haven't completed it and you're going to complete it, we want you to be patient and complete it with as much thoroughness as possible. So you're going to see a form that includes your demographics, and those are very important as well. We want to know who's there, male, female, employment, education, and things like that, where you are, geographic location. We want to know about the diagnosis experience, the symptoms when the person was diagnosed, when they visited to the providers, some risk factors, some exposure, and then the time interval. We will share with you today the report of the time interval briefly, but we want those information with as much details as possible, because when we know the times, when we know how long it's taking the person to move from symptoms to diagnosis to treatment, that becomes a quality indicator. We share it with the community. We say, this is what we have now. We want to shorten this time. We want to explore the factors that make this experience even better, more optimal, and shorter, so people can receive the treatment as soon as possible. And that can give people, as you know, the peace of the mind, can help with relieving the symptoms as well when the cancer becomes under control. There are forms for treatment, so all the medications that the person's on, the chemotherapy, radiation, and with details of the start date and end date if the person progressed to a next line of treatment. Same thing with the biopsy. This becomes particularly important because when we, a lot of researchers and also in pharma who are interested in the data, they want to know the kind of genes and the mutations and details in that as well. So if you're completing those forms, would help us if you have as much details as possible. We're not asking people at this stage to upload or their records or their information, although that might come in a future expansion of the study, as I will share later. But we want you to include as much details as possible because that help us in knowing who is there. There are also forms that are standardized on quality of life, physical activity, nutrition and diet, and alternative medicine as well for people to complete if they're using any of those strategies. Next slide. Great. So as I said, it is longitudinal. That means we're trying to understand the experiences at different stages. We want to understand what was the experience for the person before their diagnosis. So looking at some of the demographics, some of their health experiences, some of their health practices. And then we're looking at the diagnosis itself. What happened in that phase? What symptoms that person presented to when they went to the doctor, what tests they ordered, etc., at the time interval, as I explained. And then that from diagnosis to treatment, what happened in that time frame? What treatment the person got? What test, if they got progression or metastases, what happened at that time? And then this is what you're going to complete in the very first round of survey. But then we want to follow this every 6 months. And the follow-up surveys they're not cumbersome. They don't ask you to repeat any information that you have added before. They're just to let us know how the person is doing. And if they're still on the same medicine, that would be great. So just check that box and move on to the next area. But if there's a progression, you want to know what happened, if they got a rebiopsy and things like that. So become, again, comprehensive and following people over time. Next slide. Okay, so now I'd like you to focus the light on my colleague Nicholas, because he will share with you some of the preliminary results.
Thank you, Morhaf, and thank you everyone for this opportunity to present to you. Just to update you on registration, 1,300 participants have actually registered to participate in this survey, and we're very happy about that. Approximately 900 people have been able to get consents and been initiated and gone through the various stages. And I've noted in the chat there are people who have had a bit of challenge in terms of getting the email to continue with the survey. We realized that was something to do with the filters, especially with the Gmail addresses. And so we'd like to request, we'll drop in the email address and we'll share it so that you can be able to reach out to us if you've not gotten the invitation, and we'll send it directly to you. It was something. Sorry. Can you hear me now?
Yes, we can. Go ahead. And if this continues to break up, I probably can take over as well.
Thank you. And then also at month 6, we have 243 patients who've been able to complete the month 3 numbers. As you can see, the numbers are growing daily. And so we are working to remove the filters and just working with Gmail to see how we can get your emails through. So in case of any challenges, we do have the Gmail address, but we do have another new address, which is the ALK-positive lung cancer at alkpositive.org. You can shoot us just a quick email. You've registered and you've not yet gotten your forms, and we will be able to resend them to you. So we go through them every day. Once you get that, we'll be able to send you the form. Next slide, please. So in terms of treatment experience, so almost half of the people who have recorded their experiences have talked about having surgical experience, radiotherapy, or chemotherapy. and majority talked about being on one TKI or another. Immunotherapy, prescription drugs, or complementary or alternative medicine have reported very low usage. Less than 15% of people have reported being on those. But TKIs are actually the highest with over 95%. Next slide, please. So as you can see, in terms of the TKIs that have been in use, alectinib is the one that is most reported, and then you have others which are from regardless, crizotinib, and others which have been reported. But we also have people reporting moving between the TKIs, having started on one and then over time changing to another one. So this is something that we have also been able to capture. Next slide. So we included this table just to highlight how evolution over time in terms of what people have been prescribed over time. And you can see that alectinib from 2016, more and more people are actually using it. And earlier, which was crizotinib, and then the medication keeps changing. So as new drugs become available, new information becomes available, people will continue to change their medication. And we hope that people to be giving that information as it becomes available. I'll hand this back to you, Morhaf. Thank you, and apologies for the audio.
No worries. Thank you so much, Nicholas, for your hard work. Nicholas has been working relentlessly with the team and helping when there are some challenges. I want to just emphasize one thing. If you go back a couple slides to the very first one where you have, one more. Yeah, this one here. You can see the little gap between registering and then completing form. So there is that little opportunity that I want to emphasize, and we'll see how we can work with everyone, that sometimes people end up registering and then that forms don't get completed. Understandable, sometimes we get some, and we identified already a couple of reasons. Sometimes the email or that includes the link goes to your spam folder. So please, if you register and time comes and you do not receive the link, please check in your spam. If you still don't find it, email us at that email address that's included in the chat, the ALK-positive lung cancer at alkpositive.org, and then we will help you make sure that you receive that email. But I can also identify other factors. Sometimes people receive that link and they get busy, distracted, do something else. And so that is an opportunity. We see that we have potentially opportunity to include much larger number than what we have right now, and have completed data as well. And as you can see, we'll move next to Shruti sharing about the diagnosis experience. Always opportunity to, of course, to complete those surveys till the end and add as much details as possible. Please move to the next slide, and then I'll pass it to Shruti if you could fix the screen on. Yeah, now this is great, and then if you could fix it on Shruti.
Hi everyone, my name is Shruti. I'm actually a PhD student here at University of Washington working with Dr. Achkar and the team. I am very grateful to be here. I would love to share some of the insights from our preliminary analysis of demographics and diagnosis data. We looked into age, gender, racial diversity, and employment status, and some other demographics as well. And we characterized these by stages, late and early stages of lung cancer. And then, as you can see, the majority of the participants in the study fall under the age range of 18 to 69, which is like 74% of overall sample. And then gender distribution, we do see females outnumber males with 63%. And racial diversity, the study includes predominantly white population, which is about 81% of total participants. And we do have Asian population, which is around 12%, and other racial categories, which are relatively small. So there is a lot of potential there. And then coming to employment status, employed individuals constitute the largest employment group, making up 49% in the participants. We can move to next slide. Here, we looked into the percentage of participants by the origin of the country. The predominant percentage of participants come from the region of Americas and European, with few minor percentages from Southeast Asia and Western Pacific. So you can see the pie chart below, 46% of participants come from US alone. We can move to the next slide. We then looked into distribution of clinical symptoms reported by participants in both early and late stages of the study. We have a total sample size of 890 individuals. You can see some of the prevalent symptoms that were reported. You can see around 59.6% in late stage and 33.3% in early stage. Cough was the most prevalent symptom, and then there were also other symptoms reported, as you can see, which are relatively lower prevalence rates. These findings kind of provide valuable insights into the prevalence of different clinical symptoms at different stages of study, which may aid in understanding the disease progression and help healthcare professionals in early detection and management. We can move to the next slide. And then we calculated time intervals in days between time points. As you can see, like from the diagnosis instrument form, from previous literature as well, we identified 5 time points here. I don't know if the font is too small. The first one is first clinical presentation of symptom, and then the second one being date of initial chest X-ray or CT, and then the third time point, the date of first referral to a lung cancer specialist, and then the next date being date of diagnosis, and the last one, the date of treatment start. We calculated, we summarized some of the mean, standard deviation, median, and interquartile range for between these time points, and we found, we reported median here, as you can see, from the day of symptom presentation to treatment, it took 577 days, and then if you see from first symptom presentation at clinic to date of initial chest X-ray or CT scan, it's 289 days. So by analyzing the distribution of these in both early and late stages of lung cancer provides valuable insights that can eventually lead to earlier detection, like we talked about, or accurate diagnosis and patient management, and then enhanced public awareness. I think this would benefit in turn can positively impact lung cancer and ultimately improve the outcomes and quality life. So this is just the preliminary data, and we're still working on it. I will hand it over to Dr. Achkar.
Great, thank you so much. I want to comment on a couple areas, if you don't mind. One, if you could go a couple more slides. This is an area very important, just the demographics of the group. This is an area of a major interest of mine. It's actually the reason why I'm moving to Detroit. A couple more slides, go back, if you don't mind. The demographics. Go backward, yes. And one more. Yeah, this one, yes. this is really, really important. Part of it is function of where, you see more female than male. That's probably part of it, of the function of who completes survey. Female might be more engaged in this area. Who constitute majority in the support group, probably you get some of that as well. So we want to, invite our men in the group to participate, share your story. So that's something we can work on that, and please encourage your peers to participate. The racial mix, this is very important conversation that I would like to invite the group to reflect on. The distribution of the ALK-positive gene, or other genes for that matter, is not necessarily different by races. Yet the representations among the people who are receiving treatment of minorities, of marginalized communities, is low, and this is a problem. I do encourage the medical community to start paying more attention to it, so maybe including some of the funding to address the disparity in accessing treatment, in accessing, also doing some research around who's getting or not getting molecular testing to get to that result. Clearly here, and we saw this results, that it is actually effective in the duration that it takes between symptoms to receiving treatment. Also, employment status is a factor. So we're getting a group here that is highly educated, have more resources, and majority white. This is, on the one hand, well, great, you have a lot of resources, you can do advocacy, and we're doing that. But I would encourage us to think about and reflectively about who we are, and the notion of fairness. If I am surviving here, I'm surviving for 6 years now, why other people are not surviving? Why, if a person who's Black or who's poor or who's in an area where they don't have access to the same that I do, why do they not have the same chance that I do to survive and to live well and continue to contribute to the lives of their loved one? That's something I want to leave the group with. Next slide. So you can move forward more if you go back to where we were. Next. Yeah, and you can put me back on that. Yeah, this one. Thank you very much. And you can fix me back on the screen so I can go back to presenting mode. We want to expand the work of that we have started, and that's by soliciting funding from pharmaceutical companies who are interested in this work. So we want to improve the recruitment, we want to improve the data, explore areas of disparity, we want to strengthen the analysis and the infrastructure of this work so we can continue it for a few more years. Next slide. As I said, in terms of recruitment, we have been with enormous efforts of people working on this staff. Colin particularly, shout out to Colin. Recruited a lot of people from the support group, and this is amazing. But we want to bring representations from everyone, from across the globe. That's why we're reaching. This is a lot of efforts that Ken is leading, developing that database of the oncologists that take care of people with ALK-positive, and also connecting with pharmaceuticals, those who send you the medications monthly. So maybe including the brochure about the study in there, so we can get to every person with ALK-positive in the universe. That would be really amazing. This is some of the goals of our efforts. In order to improve our efforts around disparity, to include representation of people who are currently not non-English speakers, Spanish, Hindi, Mandarin, French, Italian. Language should not be a reason why somebody receives treatment or not. Language should not be a reason why we gather information about somebody or not. Next slide. And we want to make sure that our results are of a great quality. And by that, we will, in the future, once we receive the funding, invite a subsample. Japanese is also very important. Invite subsample of patients to give us their charts so we can review them and validate. This validation helps us because we can go to any group and say our results are robust the fact surveys are efficient. We can't review everybody's chart. We can't get the data from everybody and manually extract that information. That's why survey is efficient, and we can get over 1,000 of people very easily in a few months. But then we want to make sure the data is accurate. That's why we'll be reaching out to some of you who've completed the survey to help validate the results that we captured. We'll also be interviewing people. I've done this work before a couple of years ago, with interviewing people with ALK-positive EGFR and ROS1, looking at their experiences and the diagnosis. We published on that work. We want to repeat some elements of that, looking at extreme cases, who's doing really, really well, and who's doing doing or had done poorly, so we can understand what is actually taking place. Next slide. And then the same thing. This is the opportunity. The beauty of this kind of work is that you can expand it. You can take it to next level. You can add more forms there, so you can gather information about an area of interest that are particular for some certain group or certain research. We want, because the people are surviving for 4 years, and this is amazing, we want to follow them over time for as long as we can. So 7 years is great. We just started last year, and we want 6 more years. That's the reason why we're seeking this funding. Next slide. We want this presentation. The goal was to let you know about the work that you have supported, and we want to leave you with a call to action. Participate, participate, participate. We want your story. We want you to complete those survey, the initial survey, but not just that. The follow-up, please be on the watch for those emails that come as a reminder. You know, this is your time to complete your 6-month survey. So please complete it again with as much thoroughness as possible. Share about this work to other people. When you as a patient activist invite someone else to participate, the impact of your voice is stronger. This is not the University of Washington is an umbrella, and I'm going to, of course, if I go to Wayne State, to Carmanis, will move that work, the umbrella with us to be from there. But the work is an ALK-positive work, and we want you to always feel that ownership to it. Anytime you want access to the data, we'll provide you with the identified data, of course, to use it for advocacy. We'll provide summaries of this data as well. This is your work. Please help us with inviting more people to participate. Again, as I said, I cannot emphasize enough the importance of accuracy of completing that information and the completeness. This is something that Shruti dealt with, which is around the time interval. We have somebody who started, for example, completed the year, didn't put the month, didn't put the day. This is useful, but we want as accurate as possible. So it might take you a little bit more time, but please be patient and complete them with as much accuracy as possible. Again, sometimes they might not get the invite, might not get the reminder. Check your email. We're finding this problem specifically with Gmails. A lot of the emails are bouncing back to us. So if you have a Gmail account and you're participating, please check your spam if you're not getting them. And if you cannot access it, then please email Nicholas at the email that we provided for you. And then look for other research opportunities. This is a platform that will provide access for people who will be reaching out to you. They're not going to share your identified information. You trusted us with them, so they will be kept confidential. However, we can tell people that we have this many individuals, and we can reach out to you. For example, if you're completing the survey, we can include some forms to say, you know, do you have this condition? Do you have that condition? Do you fit those criteria? And if yes, we can provide you with more information, so you can directly reach out and participate in research opportunity. It's a powerful tool to help researchers recruit and potentially expedite the life cycle of doing research that could save lives in the future. Next slide. I think that's it. I'm going to pass it back to Ken, because he's going to say a few words and